1. 4.13 Wounds and Bleeding Questions. And answers graded A+. Describe the key steps in managing an arterial bleed at the scene of an emergency. Heavy check mark, apply direct pressure to the wound. Use a tourniquet if necessary, and elevate the affected limb to reduce blood flow. What is the first priority when assessing a patient with a large, open wound? AOE, controlling bleeding to prevent hemorrhagic shock. How would you differentiate between venous and arterial bleeding based on the characteristics of the blood flow? Heavy check mark, venous bleeding is dark red and flows steady LY, while arterial bleeding is bright red and spurts with the heartbeat. What signs of infection should be monitored for in a patient with a healing wound? 1/2. 2. AOE, redness, swelling, warmth, increased pain, and purulent discharge. What role does debridement play in the treatment of wounds? AOE debridement removes dead or contaminated tissue to promote healing and reduce the risk of infection. How might the healing process of a wound be affected in a patient with diabetes? AOE, delay wound healing due to impaired circulation and immune response. What interventions can be used to minimize scarring after a wound is healed? Heavy check mark, proper wound care, such as keeping the wound moist and protected, and possibly using silicone sheets or SCA reducing creams. In what situation would you expect to see a wound close by secondary intention, and what does this mean for healing? Powered by TCPDF, www.tcpdf.org. 2/2.